Okay, I wanted to take some time to show you a stretch that's really going to help with tight hip flexors. But before I get started, I just want to make it clear that I'm not a doctor, and this is in no way to take place of medical advice. Also not intended to treat, cure, or diagnose any medical condition. And of course, you're doing this at your own discretion and risk. But let's get into it. So, if you've got a sedentary job, if you're sitting, for a couple hours at home after work, or let's face it, almost every American adult has tight hip flexors. That's what the research shows. So we know that nearly everyone, unless they're doing stretches to stretch these muscles, has tight hip flexors. And that can lead to pain down the leg, transferring pain other places. And so it's really an important stretch to do on a regular basis, daily, really. And so, in fact, I recommend 2 to 3 times a day, if not more, if they're super tight. So let's go ahead and get started. So you're going to get something under your knee to support the knee. Make sure that patella or kneecap isn't right against a hard surface. And we're just going to come up at a 90-degree angle to the floor. Get a chair or something next to you to brace if you need to. And then we're going to get our posture right. So we want to brace at the trunk before we start this movement. In other words, there are 3 steps to bracing at the trunk. We're going to tuck our pelvis or hips under, like so. Pull the belly button in and squeeze the glutes before we start to move into the stretch. So again, I'll show you the difference here. If we've got too much arch in the back and the hips are forward, it's going to look more like that. Okay. If we tuck the hips under, we're straightening out the lumbar spine a little past the neutral position. So we're really intentionally projecting the hips under and forward. And then we're pulling the belly button in and squeezing the glutes before we move into the stretch and all during the stretch. So now that we've got the trunk braced, then we're moving forward into the stretch, and you should feel a stretch right in here from the quads, the front of the leg, up into the hip area. And just extend forward into that and hold it. Again, bracing in the trunk, making sure the hips are tucked under, belly button in, squeeze the glutes. Now the next phase of this is making sure that you hold this stretch long enough for the muscles to kick in and benefit from it. So the science shows that it takes several seconds for the central nervous system to signal the muscles and for the muscles to respond and stretch. So they begin that process in a few seconds, and it takes 30 seconds really for those muscles to start to release. 60 seconds is longer, or is better rather. So 30 to 60 seconds is ideal for this stretch. And so a minute isn't that long. It kind of feels long when you're doing this, but you'll get used to it and you'll be done with it before you know it. And you're really going to enjoy the benefit of it. So once you've been 60 seconds on one side, then you can switch to the other side. Move that cushion or pillow over. Again, 90 degrees from the floor, extend that leg out. We're going to tuck the pelvis under, belly button in, squeeze the glutes, and move forward into the stretch. If you see me looking down, I'm looking at my monitor. Not in the habit of looking at the camera lens yet. Okay, so moving forward, making sure you keep that bracing. Move forward into the stretch. Just feel that stretch along the front of the hips. Hold it for 60 seconds. No less than 30 seconds. And again, once a day very seldom brings relief. if you've got tight hip flexors. So 2 times a day, 3 ideally. So first thing in the morning, before you go to bed at night, and once during the day, maybe at lunchtime. Just dropping and doing this takes 2 minutes to do it, maybe 3. And give us some comments below. Let us know how it worked for you. Thanks for watching.